Hello, welcome to ANA community. In this particular video, we are going to discuss the differential diagnosis of a pain abdomen, one of the most uh, commonly observed symptom and one of the most difficult symptom that has to be evaluated as such. When you think about the pain abdomen, that is considered to be the any kind of the discomfort, maybe the pricking type of pain or maybe the burning type of pain, etc., that may be observed in the abdominal region. When you think about the abdomen, any kind of the pain observed, the following aspects has to be evaluated thoroughly. They are onset, duration, location, radiation, character, severity, aggravating and relieving factors, and negative history. Each of these are having its own significance when you are going for the diagnosis of the disease or differentiating the disease based on these different parameters. When you think about the onset as such, if the person is having the acute pain, that is sudden pain, wherein the person may have the pain that is developed immediately because of the cause as such. For example, the person is getting the pain immediately after the consumption of spicy substances, etc. That may indicate acute condition. Whereas the gradual onset, that may usually indicate chronic condition. And if it is insidious, where the person is not in a position to decide whether it is acute or chronic, that is termed as insidious. This may be observed, for example, in case of hepatobiliary dysfunction, wherein the pain may be unable to perceive, and that may be associated with yellowish discoloration, which is also initially probably not identified by the uh, person who is suffering from. He may be uh, asked by the uh, nearest and dearest ones or friends, etc., regarding their yellowish discoloration, etc. So here in this particular occasion, the probable presenting complaint as such pain abdomen, that may be insidious as such. As far as duration is concerned, that has to be mentioned in the chronological order. Chronological order in the sense you need to identify which symptom has occurred first and which symptom has occurred next and which symptom has occurred even further as such. So here one example was being put forth. For example, if the person is suffering from pain abdomen since 7 days, later he is having the nausea since 6 days, and immediately after nausea he is having the vomiting, that is also the duration is since 6 days. That may indicate the probable site of the lesion may be at the stomach level, maybe at the gastrium level. So the further, if the pain abdomen, if it is associated with the presence of the blood in the vomitus as such, so that may indicate upper gastrointestinal hemorrhage. That is, that too, if it is frank blood, then that may indicate the site of the lesion may be in the esophagus. And if the person is having the coffee ground vomitus, so that means a dark black color, in that particular situation, the site of the lesion may be in the stomach, and that may indicate the bleeding is present in the stomach region. As far as location of the pain is concerned, we need to identify exactly which particular location the person is having the pain. It is being the arbitrary 9 regions of the abdomen are being made in the name of right hypochondric region, epigastric region, left hypochondric region, right lumbar region, umbilical region, left lumbar region, right iliac fossa, then hypogastric region, then left iliac region. In that way, so you need to identify which particular location the person is having the pain. For example, if the person is having the pain in the epigastric region, we may think the probable site of the lesion may be stomach or esophagus, that is lower end of the esophagus, or pancreas or liver as such. Suppose if the person is having the pain in the right iliac region, the probable organ afflicted may be colon, appendix, ascending colon, that is the initial part of the ascending colon, sometimes ureter, in case of the females, ovary, etc. These are the probable organs that may be afflicted. Suppose if the person is having the pain in the left hypochondric region, the probable organ afflicted may be the spleen or the splenic flexure, the connection of the, what do you say, that the transverse colon and descending colon. So like that, we need to identify the exactly which particular organ that can be afflicted. That can be done by noting about the location of the pain. Then, radiation of the pain, for example. Suppose if there is a radiation of the pain, wherein we are going to observe radiating towards the retrosternal region pain. In that particular situation, so that indicates the probable site of the lesion may be stomach and esophagus. That too, upper alimentary canal dysfunction can be predicted. Suppose if the person is having the pain which is radiating from epigastric region towards the left hypochondric region, then the probable site of the organ afflicted may be pancreas. Suppose if the person is having the pain which may be radiating from loin to groin, in this particular occasion, the person is having the pain which is radiating from right loin to right groin region, the probable organ afflicted may be ureter. And if the person is having the pain in that particular point, for example, here right hypochondric region, the person is having the pain, and if you are noting that particular pain is exactly in the similar line, that is arbitrary line, that is drawn from left anterior superior iliac spine, passing through umbilicus, which is meeting at the right costal margin, then it may indicate the probable site of the organ afflicted may be gallbladder. In this way, the location of the pain, etc., that as well as radiation of the pain that may help in the diagnosis. Suppose if the person is having the pain which is located initially in the umbilical region, after a matter of the few hours later, the person is developing the pain in the right iliac region, but later there is a disappearance of the pain in the right, that is the umbilical region, then that may indicate the shifting of the pain. The diagnosis may be appendicitis. Suppose if the person is having the pain in this particular region itself, probably the site of the lesion may be stomach. As far as the character of the pain is concerned, suppose if the person is having the burning type of pain, that may indicate hyperacidity, that is indicative of excessive secretion of hydrochloric acid in the stomach. Suppose if there is a pricking type of pain, as if the needles are being used to prick that, then that may indicate usually inflammation that's happening on the area where the person is feeling the pricking type of pain. As well as the squeezing type of pain, that is as if the clothes are being squeezed to remove the water during washing, that may indicate cramps. that may indicate electrolyte imbalance as such. So in this particular occasion, we may observe such kind of the pain in cases of the, what do you say, that the obstruction that may be observed in the tubular structure, such as bile duct or appendix or ureter or intestine. That is that is what is considered to be the colicky type of pain. That is indicative of, as we have discussed, that is the some kind of the obstruction has happened in the hollow structures. As far as severity is concerned, so basically three types of the severity are being mentioned: mild, moderate, and severe. When you are observing mild variety of the pain, so that is indicative of the person is able to do his routine activities. That may indicate mild pathological process that's happening inside the abdominal region. Suppose if the person is having the moderate variety of pain, where the person is able to withstand the severity of the pain after taking medications, and later he is going to do his routine activities, that may indicate moderate to severe pathological process happening inside the patient's abdomen. Suppose if the person is having the severe the variety of the pain, then that may indicate the my moderate to severe pathological process that's happening inside the abdomen, wherein the person is not able to get the relief from the pain by whatever means he is going to take. This is about the significance of severity as such. As far as course of the symptom is concerned, the course of the symptom is being decided by looking into the severity which is being present on the first day and the present day. Suppose if the person is having the severe pain during the first day, and the same kind of the severity is being observed in the present day, that may indicate that the exposure of the causative factor is continuous. Suppose if the person is having the improving course of the symptom, in the sense, initially the person is having the severe variety of the pain, now he is having the mild variety of the pain, that may indicate the person is having the exposure of the causative factor is reducing. Suppose if the person is having the worsening course of the symptom, in the sense initially he has the mild variety of the pain, now he is having severe variety of the pain, that may indicate the exposure to the causative factor is increased. Then we need to think about the aggravating factors as such. When you are observing the certain aggravating factors, so which will be helpful in determining the exact pathological events as such. For example, here, if the person is consuming the food and which actually worsens the pain in the epigastric region, that may indicate the probable site of the lesion may be in the stomach region. Suppose if the person is consuming the spicy food substances, after that he is getting the pain abdomen, the epigastric region, which is being followed by vomiting, that may indicate the hyperacidity syndrome. For example, if the person is having doing the traveling, at that particular time he is having the pain in the abdomen, which is radiating from loin to groin, that may indicate the probable cause of the illness may be renal colic. As far as relieving factors are concerned, suppose if the person is having the relief of the pain by taking the antacids, that may indicate acid peptic disease or hyperacidity syndrome, or otherwise we may say amla pitta. Suppose if the person is having the relief from the pain by taking the antispasmodics, then that may indicate the probable obstruction that's happening in the hollow structure, such as bile duct or the ureter or appendix or intestine. And if there is the relief of the pain by vomiting, that may indicate the probable site of the lesion, cause of the disease may be gastritis. If the person is having the relief from the pain by taking the food substances, that may indicate the site of the lesion may be in the duodenum. So like that, the differential diagnosis can be made based on this particular part. Apart from that, the differential diagnosis can also be done by noting the negative history. For example, the absence of vomiting that may confirm the diagnosis of the disease is not gastritis or pancreatitis. Suppose if the person is having the absence of diarrhea, that may indicate the site of the lesion may not be either in the small intestine or large intestine. And if there is absence of yellowish discoloration, that rules out the diagnosis of the liver dysfunction or gallbladder dysfunction or common bile duct dysfunction or the pancreatic duct obstruction as such. And absence of colicky type of pain, that rules out the obstruction in the hollow structure, such as the ureter or the bile duct or the intestine or appendix. And absence of burning micturition, that rules out the affliction of a urethra. So like that, the negative history will be helpful in making the differential diagnosis. To sum up, the abdominal pain is one of the most difficult symptoms to make the differential diagnosis. If you are very keen about the onset, duration, location, character, radiation, severity, course of the symptom, aggravating and relieving factors, and negative history, then the accurate diagnosis of the disease is comparatively easy. In cases of which may indicate either alimentary canal dysfunction or hepatobiliary system dysfunction or urinary system dysfunction or integumentary system of the abdominal area or muscular system of the abdominal area can be considered. Or otherwise, in some of the occasions, even the cardiac dysfunction may also be possible. That's why the elaborate case history is one of the key area which helps in the accurate differential diagnosis of plain abdomen. Hence, listen to the patient carefully. He is actually telling you the actual diagnosis. Right diagnosis is the key for the fast and right kind of the treatment as such. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.